So here we got Zach George and Dr. Verdasta yet again, and I'm going to explain to you what Dr. Verdasta is actually not talking about. She's omitting a lot of things, and I think there's a bloody reason for it. She's lying to you, and I'm going to prove it. And Dr. Verdasta, I've already sent you an email. I've sent your colleagues an email. Do I need to launch a lawsuit against the American College of Vet Behaviors to get your attention, to get a response to you? Because there's no more hiding from this. You're not going to hide from this stuff anymore. Dr. Lisa Radosta right now is the current queen bee of all this scientific consensus. Okay? It's not science, it's scientific consensus. And what is the scientific consensus? If you can get enough birds together that are willing to chirp the same song, there's your consensus. It doesn't make it right. Let's have a listen.
What does the current scientific evidence tell us about the methods and how they impact stress levels, emotional health, and things like that? Why are these methods that we see so commonplace in the dog training field? Why are they, or are they harmful? I'll just go from there.
Now, let me first say to you that vets are actually doing harm to dogs. Dog trainers are doing harm to dogs. They're all feeding the pet care conglomerate, this $100 billion industry, and the dog is paying the price for it. Okay? Everybody's making off like bandits.
Aversive can mean just things you don't like, right? Like, so let's be clear, things that cause, that work by causing. So not that cause, because I want to set aside the argument that even a buckle collar can be aversive. Yes, it can be. So I'm just
Now understand, this woman gets on our YouTube channel and talks about positive punishment. There's no such thing as positive punishment or negative punishment. It's made up terms to blame B.F. Skinner. The real terms is not positive punishment, but primary compulsive inducements under Conrad Most. That's the reality. B.F. Skinner, again, had nothing to do with this garbage. They redefined positive reinforcement and negative reinforcement.
going to say tools that work by causing pain or startle or fear. Like that is how they function to change behavior. So we avoid you.
You're not changing behaviors, you're shutting down behaviors. And any dog trainer out there that's telling you to shut down a dog aggression is downright dangerous and stupid, because I guarantee you at some point you keep doing that, the cause is going to grow heads and the behavior is going to get worse. And at some point when dog trainers get bit, or when somebody gets friggin' bit in the family, guess what? Do you think dog trainers or the vet behaviors are going to take the blame for it? They're going, no. I sell my time, I don't sell results.
Using those things because specifically shock. So not as much research on choke and pinch. The choke collar research is mostly about effect, like increase in ocular pressure and things like that, right?
And things like that, but she doesn't get into the thyroid and whatnot. You see, if you look at the mirror and feel for your Adam's apple, men and women, right on both sides of the Adam's apple, just below it, you got your thyroid and you got your parathyroid. Now these are gelatinous little organs. If you damage those, guess what? You're going to cause a hypothyroid condition. Never mind the trachea, which is only made of cartilage. And I've met dogs with damaged tracheas because the dog trainers yanking and cranking on these freaking prong collars. Now, one of the big problems today is that trainers or vets are actually declaring that hypothyroidism is overdiagnosed. But yet, if you go listen to Jean Dawes, who's one of the leading people on the dog's endocrine system, she will tell you point blank that hypothyroidism right now is under epic proportions. One of the big side effects of hypothyroidism is unexplained allergies. It mimics allergies to a T. And if you get into Facebook groups and look at the dogs, and how many dogs out there right now are suffering from unexplained allergies? Vets have them on food trials, shampoos, drugs, the whole 9 yards, but are not testing for hypothyroid. And I've had vets argue with me, Western vets argue with me, that you know what, it's a waste of money to test for it, but here's some frickin' prednisone. Vets are now giving out prednisone like candy. And what does prednisone do? That steroid is actually going to decrease thyroid or function further. Why isn't she talking about this?
So we're really looking mostly at shock. There's a wealth of research on shock, and there isn't a study.
Yeah, and if you're shocking the dog's neck, people, you got to understand that the anatomy of a dog's neck is no different from yours. Go up and look at the comparison between the dog's neck and your neck. It's all the same anatomy. If I started shocking your neck, it's going to cause some serious problems. If I started cranking and yanking on your neck, it's going to start cause some serious problems. If I did like Dog Daddy and wrapped a prong collar around your neck and lifted you off the ground, body and bones, you're going to need a bloody ambulance and emergency care. But people are cheering, yay, the dog is fixed. No, the dog is not fixed. The dog is completely shut down. Now, also with the choke collars and whatnot, she's only mentioning ocular pressure, which means your eyeballs are going to go under pressure. She's not mentioning the fact that it can actually cut off blood flow to the brain, which is cutting off oxygen to the brain, which can actually cause brain damage very quickly. There's a whole lot she's leaving out here. Why? It's not efficient. It's not effective for her, right? Doesn't make money.
That shows that shock has causes the same amount of stress or less than positive reinforcement.
Then positive reinforcement. Now here's the kicker. She's always selling positive reinforcement as applying something. What she calls positive reinforcement and blames Skinner for is a misrepresentation of positive reinforcement. Positive reinforcement is everything you are. Positive reinforcement and operant conditioning can be used interchangeably. It's all your hopes, your desires, your wants, your needs, and your desire to stay safe. It's all your fears. That's what positive reinforcement is. But yes, she's selling positive reinforcement as have a treat. That's the reality. It's not have a treat. Why is she doing this?
So what I'm
Either she's blatantly lying or she's blatantly ignorant. And at this point, I couldn't handle if a vet of 50 years or 40 years or whatever she is blatantly bloody ignorant, because ignorance can be taken care of by reading a book.
saying is the opposite way. There isn't a study that shows that shock isn't more stressful. This is separate.
Why do we need studies to show that these tools, these aversive tools, are causing problems? If you wrap a prong collar around a dog's neck and start cranking and yanking, and I mean, look at Garrett Wing. I mean, he's got an 80-pound Rottweiler or a 100-pound Rottweiler on a leash. The man weighs 200 pounds, and he's winding up. He's just waiting for that dog to lunge so he can yank on that freaking prong collar. Now, the thing of it is, we got dog trainers out there right now that are doing physical damage to dogs. They're actually damaging the dog's neck, they're damaging the dog's trachea, they're damaging the dog's thyroid. The dog is going to the vet. The vets aren't testing for hypothyroidism, but yet they're all the food trials and everything else, they're making money off of it. They're making money off treating the symptoms, and nobody's looking at the cause. Why? How much more damage can you do? There's a lot of nerves in the dog's neck. Never mind the back of the neck when you're using a choke collar. That's reality. You can actually break the freaking dog's spine.
From whether or not shock suppresses behavior, because I don't think anyone's going to argue that it can suppress behavior. If you beat a child, you will suppress its behavior.
But the problem is, again, what Skinner says is that the punishment is the reverse of reinforcing. This is why you need the constant threat of punishment. You don't just spank a child and then leave it at that. You're going to be saying if you do it again, you're going to get spanked again. That's the constant threat of punishment. There's a reason why they're telling you to leave a treat bag in your side, because it's a constant threat of punishment. And treats are punishment in many, many situations that people don't realize. It's not positive reinforcement. It's not positive at all. If you're leaving a prong collar or an e-collar on the dog because it's an insurance policy, because you don't want to take chances, you're using the threat of punishment all the time. The dog is always under the constant threat of some kind of punishment, because punishment doesn't work. It's a reverse of reinforcing.
We know that things that hurt suppress behavior. The question is that the way we would want to parent a child, right?
But yet, are you going to parent a child by giving them reward for every good thing they do? Because you'll screw that child up for life. That's the reality, right?
Right? Mm-hmm. Wouldn't we want to parent our child in a way that is effective and the least stressful? Because we know that the more stressed you are, the less you're going to be able to acquire new skills, right? But the more stressed you are, the more quickly you will acquire traumatic memories, okay? All right. So even the study that I see people grasping onto, which is the recent predatory chasing study
that would be Ivan Balabanov. And the only thing that I'm interested in that Ivan Balabanov study is the fact that clearly, right down at the very bottom, they said that these tools should only be in the hands of professionals. Why are they being sold in stores where any Joe Blow can get them? That's my question. Shock collars and e-collars need to be banned. So do treats, because they're all part and parcel of IGP dog training. All the crates and the muzzles, everything else, they're all part and parcel of dog training. IGP dog training, which is formerly known as Schutzhund. When you're teaching your dog obedience, is what these people are pushing, it's a part of IGP dog training. That's the reality, and people don't understand what IGP is. You're trying to use a technique, and you don't understand what it is in the first place. And people are wondering why it's not working.
Use shock and also use positive reinforcement.
You don't use positive reinforcement. Positive reinforcement is not something you apply. Right now, she's going to define operant conditioning as a method of behavioral modification using reward and punishment, because reward and punishment, that is the quadrants of dog training. What Conrad Most called carrot and stick. That's the reality.
So even in that study, the dogs were more stressed.
And I got to ask, again, are you blatantly lying or blatantly ignorant? Because at this point, you better be blatantly lying. Because if it's blatant ignorance and stupidity, that can be covered by reading books. And if you're too lazy to get off your ass and read a book, then we got some serious problems.
It's not a question of the stress. So what I kind of always say to people, if you had a choice, this is what I say to veterinarians, because I'm still overwhelmed that they would recommend methods that aren't scientifically valid, but whatever. I say to them,
get rid of it all! Why can't we get rid of it all? Get rid of the freaking treats. You show me Zach George training a dog. If I take his treats away, he's going to be standing there like an idiot. You show me any dog trainer And they're all IGP dog trainers trying to use one quadrant. There's no such thing as a positive reinforcement trainer. They're primary inducement trainers. They're IGP dog trainers trying to use one quadrant of a four-quadrant system of IGP that was never meant to work in the behavior in the first place. And Dr. Radosta, if you don't know this, you better open a freaking book. That's the reality.
You have two pills. You got a dog in front of you with a urinary tract infection. One pill has a possible side effect that the dog could gain some weight, but you know that if you modify the diet, that the pill will be highly effective and the dog won't gain weight. The other pill has the side effect of potentially traumatizing the dog permanently, and we know that the adverse event of increased stress behaviors is highly likely. You got two pills. Which one are you going to choose?
There's a third pill. It's called psychology. What is psychology but the very study of the mind and behavior? Behavior itself is a scientific field of its own. That's the reality. This is all B.F. Skinner. What again they're pushing is Conrad Most training dogs. And if people would sit down and read the book, they would understand that Dr. Radosta is actually lying to them. She's pushing Conrad Most just like the rest of them are. And again, doctor, do I need to bring a lawsuit against the American College of Vet Behaviors to get your attention, to get a response out of you? Because if that's what's going to be required, I will do it. I will make sure it happens. This is going to stop. Enough dogs are dead. Enough dog owners' lives are destroyed. And enough dogs right now are behaviorally ill-behaved as a result of all this garbage. But yet the pet care conglomerate carries merely on, and these are all part and parcel. These people are all part and parcel of the pet care conglomerate. It's a $100 billion industry. And everybody's making off like bandits, aren't they?
No veterinarian in any country in the world I've ever lectured chooses the pill with more side effects.
Sure, I see vet behaviors that are pushing prongs and e-collars. You might want to look a little bit harder, because they're all doing something. Why would a vet knowingly push e-collars and prongs that knowingly can damage the thyroid and damage the trachea? Why would they do that? 2 years ago, it was all about spay and neuter. All this brand new information came out about spay and neuter. And vets wrote, oh yeah, you know, the data actually showed that intact dogs are far healthier than spayed and neuter dogs. And vets were all over YouTube. Oh, we take it into consideration. You know, it's all brand new information. Well, how many vets have changed? Because I'm seeing vets out there right now still pushing spay and neuter. Why? Because it's guaranteed income down the road for somebody. You cut the nuts off a dog, or you do a hysterectomy on a friggin' female puppy, and I guarantee you down the road they're going to make money off it. This is the reason why they keep doing it. There's no money in vasectomy and tubal ligation. It's a very fast operation, it's a very cheap operation, but yet they still won't do it. Why? Ask yourself that question. Always ask the question why.
So why do people choose that pill, the shock collar, as opposed to the food?